You've certainly heard the good news by now that the risk is low of hantavirus turning into a pandemic. That's what we're hearing from the World Health Organization and the CDC. But I wanted to explain for a minute why they are saying that. Typically, there are three things that they look at to try and determine the level of concern. Something known as the reproductive number. Now, this is a number that basically says if you have somebody who is infected with the virus, how many people are they likely to spread it to? When they look at sort of outbreak averages when it comes to hantavirus, that number is around 1.19. Okay, keep that in the back of the mind and also compare it to COVID, which was certainly higher than 2, probably closer to 4. Another thing that they look at is how infectious is the window for somebody who has hantavirus. How long can they spread it for? And what they find, two important things. First of all, people don't tend to spread the virus unless they are sick. Very important. Remember, with COVID, people could spread this even before they had any symptoms. And typically the time period through which they can spread this is around 1 to 2 days. So that's another important piece of data. The third thing is just how stable is this virus? We looked at genomic sequencing of this virus going back to 1996, compared it now to 2026, 30-year time difference, and they find that the genome stayed pretty stable. Again, remember with COVID, there are all these variants that happened even within the first year. Hopefully that won't be the case here. Let me show you something really quick. This is a real-world sort of depiction of how this virus might behave. The person on the left there, that is a man who entered a birthday party, was there for about 90 minutes. He was sick when he came into the party, and during that time he infected 5 people. Most of those people were anywhere between 1 to 4 feet away. Over time, 11 people died from that super spreader event, and 34 people were infected. And if you look at this chart, you can get an idea of sort of how that spread happened. This is what scientists are most concerned about. Again, the good news is that the infectious window is very tight. In fact, 80 healthcare workers cared for the people that you see on the screen, and none of those health workers got sick. But that gives you a little bit of background as to why at this point the concern is low that this is going to turn into a pandemic.